had the budget hearing of Philhealth. So I just like to greet all of them, and I'm happy that you're having this separate hearing because there's so much going on in Philhealth that all the more information we have, the different presentations, even the ones that you presented, are much welcome in understanding what the needs of Philhealth are so that they can deliver the best kind of universal health care for the Filipinos. So we're just here to listen and support your honors. Thank you very much.
Yeah. Kami ang grateful, especially not only for the quorum, but really for partnering since you became a senator in 2004 now with the health sector, the healthcare sector. So thank you very much, Senator Pia. Senator Bongo? We'll get back to Senator Bongo, our chairperson of the Committee on Health. Let me acknowledge para hindi na magdalawang ikot, I'll acknowledge you tapos opening statement. So, Philhealth family, led by the OIC President, Attorney Ellie Dino Santos. Sir, you're recognized.
Thank you, Mr. Chairperson. Good afternoon, Mr. Chairperson. Honorable Senator Pia Cayetano, Honorable Senator Bongo, good afternoon. Good afternoon, fellow public servants. We will open our statement to address the recent issue about the fund life of Philhealth. Our statement is that Philhealth is here to stay. Why? Because Philhealth is a going concern, meaning it can meet its obligation when they become due, functions without threat of closure for the foreseeable future. It will continue to meet its current plans. The fund life of Philhealth is dependent on how we manage our income versus our expenses. For income, we have the national government subsidy, we have the contribution from PCSO and PAGCOR, we have contribution from the employed sector, as well as interest from our investment. As to the expenses, we have benefit payouts to our partner providers. We also expand our benefits under the Universal Healthcare Law. Philhealth will last indefinitely so long as we are able to efficiently manage our income and expenses. It is in our hands. There's no limit in the lifespan of Philhealth right now. Again, Philhealth is here to stay. Thank you very much, Mr. Chairperson, Honorable Senator Pia Cayetano, and Senator Bongo. Good afternoon.
Sir, thank you for that statement. It's reassuring. But personally, I understand. Pag hindi nyo sinabing merong pong time lang na mauubos din ang pondo, hindi magkakandara pa ang gobyerno na dagdagan kayo ng pondo. Pag sinabi mo naman may time, magpapanik naman na baka mawala ang PhilHealth. So for any organization or entity handling these kind of things, no, whether it's insurance or social protection like SSS, GSIS, etc., even sa US, di ba? It's always a balance. When do you sound the alarm bells that you do need more funds, and when do you naman assure people that hindi kayo mawawala, di ba? So I think that should be clear to our people, and you know, we should understand that it's your duty to na mga lampag, no, na you do need more funds. So having said that, the second, they're not here yet, but the Private Hospital Association of the Philippines, let me just still recognize the president, Dr. Jose Rene De Grano, and Dr. Arturo S. Flores, board member ng PAPI. Of course, we are very grateful for them during lalo ng pandemic, di ba? Yung ating role ng private hospitals. One quick question na lang, sir, kahit wala pa sila. Kamusta yung payment sa kanila? Is it more smoother ngayon or may mga complaints pa rin? Or?
Sir, right now, sir, we are current in our payment. Under the law, we are mandated to process and pay within 6 days from receipt of the claims. Right now, sir, our average turnaround time, meaning the number of days we pay them, is 41 days, sir.
Okay.
So below the 60 days requirement, sir. Thank you very much.
Okay. And siguro continuous naman dialogue nyo dito sa mga associations. No?
That's correct, Mr.
Okay.
Chairperson.
But feel free to use the committee, no, if you need a venue for dialogue nga. Kaso sa nababasa sa news na hindi nagbabayad, may problema. 'Di ba? Kasi sa dami ng inaalala ng tao, anything we can work out to the advantage of our people, let's do it face to face, 'di ba? Pwede naman open naman, transparent, but ibig sabihin mas mahirap magsagutan sa media, 'di ba? So, Philippine Nurses Association, Melvin Miranda, sir, National President, online ba? Or, yeah, sir, you have the floor. Thank you for being with us today.
Thank you very much, Honorable Chair. Honorable Senator Alan Peter Cayetano, Committee on Government Corporations and Public Enterprises, to Honorable Senator Pia Cayetano, Honorable Senator Bongo, to distinguished resource persons and officials, good afternoon. Our opening statement is on Philhealth, the public, the Filipino nurses, a need to assess Philhealth's status. Philhealth's mandate is to ensure affordable, acceptable, available, and accessible healthcare services for all Filipinos, including the legally mandated health insurance coverage. Those who cannot afford to pay medical services are subsidized under the law. This is more emphasized in the Universal Healthcare or UHC law, where every Filipino shall be automatically included in the National Health Insurance Program. Furthermore, every Filipino shall be granted immediately the qualification and eligibility for health benefit packages. Philhealth's financial standing is such that it continues to invite suspicion if it could ever meet its social obligations. Until now, it has failed to pay insurance claims of private hospitals for services they rendered because of COVID-19. This has a profound impact on the payments of salaries, facilities, and other hospital expenses. If there is something that needs to be overhauled, it is the way Philhealth is managed and its orientation towards universal healthcare. As long as Philhealth becomes the breeding ground for corrupt managers, then private hospitals will continue to suffer, affecting, as it does now, their critical human resources, unpaid healthcare professionals working in these hospitals, nurses, doctors, midwives, and other healthcare professionals, and who serve as frontliners will be enticed more to work abroad while leaving behind a big Filipino population in need of medical and healthcare services. The challenge is to change policies involving PhilHealth. We propose the following as they affect not only Filipino nurses, but also their families and the Filipinos they help as a matter of duty. Number one, PhilHealth should be generally funded by public funds. It should not be dependent on the amount of contributions that Filipino workers provide. It must be noted that PhilHealth derives its funds from 95 million direct and indirect contributors. It also recently increased the premiums to be paid by overseas Filipino workers, at the most 38,400 per year. With this huge source, the drawback is that it makes Filipino wary of contributing more. They believe that the amount deducted from their compensation will only land on corrupt PhilHealth managers. With little incentive, they get even with mandatory deduction. There is little source of trust in the system. Furthermore, with funding coming from a national funding appropriation, then there is equal access to health services regardless of one's status in life. Number two, the benefits provided by PhilHealth should be expanded. The care provided by law should extend not only to the current list of benefit coverage, but also to other individual-based primary care services. Number three, there should be clear delineation of financing of public healthcare services among local government units, the Department of Health, and the PhilHealth. The situation today is that local government units must provide compensation, finance facilities, and undertake the procurement of commodities. As for the Department of Health, it can also provide the necessary human resources, staff, frontliners. However, these considerations are not included the moment PhilHealth charges its packages. The 2018 Mandanas ruling will certainly affect the roles of the entities, LGUs, DOH, and PhilHealth, as more sources will be devolved to the LGUs than PhilHealth. Fourth, PhilHealth should be mandated to make sure that its primary care benefit packages are utilized. Quality of services, sufficient number of providers, and human resources must be strictly monitored so that it will meet the increasing population coverage under the Universal Health Care Act. On the other hand, PhilHealth's information campaign should be reviewed, if not vigorously supplemented by other means, to better reach out to the people, nurses, midwives, doctors, other healthcare professionals, and human resources tapped by the Department of Health and local government units should be continuously supported through incentives to properly function well and communicate to the public the need to know about PhilHealth programs. Albeit the challenges are many, these are some of the recommendations we seek to share. Our nurses are the frontliners of the healthcare system. As such, it is our mandate in the Philippine Nurses Association to assure them that their welfare, their families, and that of the public is taken care of through the channels of effective legislation. Thank you very much, Honorable Senator.
President Melvin, thank you very much. That was very comprehensive kahit maikli yung time. And surely we'll have a discussion on those points. Let's see if may time mamaya, pero kung walang time mamaya, for the budget hearing, please feel free to also use my office with the recent pronouncement of President Marcos that dapat talaga dagdagan yung benefits ng nurses. Baka you can help us with the comparison, no? Sa government, sa public, but what they also get abroad. Di ba? Para magkaroon ng, how do I put it, more accountability or starting point dun sa discussion kung paano. Rather than generalizations lang na let's take care of our nurses, let's take care of our police, let's take care of our educators, di ba? So we'll get back to you later. Thank you very much for that. No?
Thank you.
Kapisanan ng manggagawa sa GOCCs at GFIs, Kamangfi, Mr. Christopher Bautista, Chairperson. Sir.
Good afternoon, sir. Good afternoon, Senator Bongo and Senator Pia Cayetano. I am representing the 36 GOCCs and GFIs under the Governance Commission. Two things, sir, that we wanted to point out for this particular hearing. One is the problem being presented to us has something to do with the representation. As we look into the charter of Philhealth, 17 the members of the Board of Trustees are from the government. Only 3 are from the workers and 1 from the private sector. So I think, like our representative from the Philippine Nurses Association, we just recommend something to the corporation in which we are a member or which we own. So walang sense of ownership because kami pinapatawag lang yung mga manggagawa at the time na at the height of a problem. Second, speaking on behalf of the GOCCs and GFI workers, we contributed 352 billion at the height of the pandemic. So we are also frontline workers and we have contributed at a very short span of time that big amount to the government. Third, we have a problem with our healthcare as we recently received the executive order implementing the compensation plan for GOCC. So it is connected with the charter of Philhealth because Philhealth is mandated to set up a healthcare plan for the government corporate workers. So we are waiting dun sa preparation of the policy that will implement. And merong directive from the GCG to stop the existing practices. Tama po kayo kanina doon sa nabanggit, we receive various disallowances from COA because of that particular policy which prohibit basically all the government offices including GOCCs to procure healthcare insurance from private agencies. And we are looking at the labor management relation policy na nagkaroon po, sir, ng overlapping of function because the Public Sector Labor Management Council, which is supposed, the entity that's supposed to govern the public sector relations, it seems na encroach ni Governance Commission yung power na yon because it listed so many things within the EO signed by then President Duterte na it speaks of the limitation of the workers in the corporate sector. So one of that is yung aming pong healthcare plan. So na-limit po ito, sir. Thank you.
On that last point, sir, if you're willing to be part of a technical working group, let's form a technical working group today on that EO and immediately submit our findings to the palace as well as to the commission, especially nga kung lumabas yung COA based on that per gitna nung taon. Napakahirap especially kung meron ka namang kinontrata na healthcare provider, bayad na yun eh. 'Di ba? Existing na yun for the year eh. So it'll create a lot of problems, no? As to your first point as to the representation sa board, that's very well taken, and maybe I can ask our OIC president to consult din yung board. You know, last week I was in the board meeting ng PUP, and hearing the student region speak, I was very happy because when I was in the student council ng UP, isa naming pinaglalaban na magkaroon nga ng student region. At naalala ko during that time, tinatarayan pa kami nung iba. Parang, estudyante kayo eh. Bakit kayo nasa board? Anong pakialam nyo sa board? Let the administrators do it, di ba? Then we return the question to them. So gusto nyo, kami naman ang mag-represent sa inyo, sa SSS or sa ano. Sabi na, ayaw namin. Ganon din kami. Bilang estudyante, gusto din namin na mag-represent sa amin yung nararamdaman. Having said that, if you look at the TESTA board, sa sobrang laki nila, parang committee hearing, hindi parang board hearing eh. So I was tempted to ask you, sir, whether the proposal is paliitin yung board at mas maraming representasyon ng manggagawa or palakihin na mas marami. But if it's okay with you, let's both have like 7 to 15 days and submit nga. Kasi especially if that's an amendment to the law, but we do want to have a perfect-sized board that's well represented, di ba? Not everyone has to be naman sa board eh. Pwede namang merong advisory council naman eh, di ba? But, I mean, did you ever hear of a private corporation na 20, 25, 30, 35 board members? Hindi. Kung meron man kayong matutulong ganun sa akin, may executive committee din sila na parang 5 board members lang o 3 na sila din ang nagpapatakbo. So I'm all out for proper representation at tama yung sinabi ni Sir Bautista na yung ano no between the technical and government and yung manggagawa. So ang issue doon is representation, no? But my other issue nga is to make the board effective talaga. We don't want na sa papel ang ganda ng meeting nung 20. Pero actually kasi pag 20 magsalita lang bawat isa ng 3 minutes sa isang issue, isang oras na 'yon. So kung 6 ang issue niyo that day, that's 6 hours sa requirements din ng commission na mag-meeting kayo ng madalas. Bus din ang oras niyo no? So anyway, on those 2 points, no? So number 1, let's in 15 days kung pwede ho na may input din kayo, ano tingin ng board nyo. This is more consultative lang naman, diba? We will not take it as the official stand unless you say that this is the official stand ng board nyo. But of course, manggagawa at sa Nurses Association and other unions, if I may call it that, and people's organization, diba? If it could be your official stand, then it would help us naman, no? Thank you for that. So next, we have the Philippine Government Employees Association, PGEA, Miss Esperanza Ocampo and Don Bo. Yan.
Good afternoon.
Hi, good afternoon. Yes,
Don
please, sir.
Opo.
Hi, sir. Don Bo, sir. Thank you, sir. Pasensya ka na kung hindi ko alam kung European, English, or Filipino pronunciation. So, Bo, yan po. Co-chairman ng PGEA Legislative Committee. Sir, you have the floor.
Thank you and good afternoon, Mr. Chair, Honorable Senators Pia Cayetano and Bongo, and distinguished resource person. Thank you for inviting the Philippine Government Employees Association in this meeting. The Philippine Government Employees Association, or PGEA, welcomes the planned review of Philhealth Charter and relevant laws to identify possible policy reforms that will address the identified gaps or areas of improvement in the delivery of healthcare services to its members and to the Filipino people in general. As a Federation of Public Sector Employees Association, The PGEA would be honored if the distinguished senator and its committee will give PGEA an opportunity to participate in the crafting of policies that will redound to the benefit of its members. It should be noted, though, that as much as we want reforms in the delivery of healthcare services of Philhealth, we believe that such reforms, as much as practicable, should not result to additional burden or contribution to its members who are adversely affected by the COVID-19 pandemic. Considering that PGEA has just been informed of this plan task just few days ago, we have preliminarily identified some areas of concern that this honorable committee may consider. In this connection, may I request the Honorable Chair to recognize my colleagues, Ms. Elizabeth Duco and Mr. Ferdinand Katukutan, to briefly discuss this point. Our President, Mrs. Esperanza Ocampo, is coming from another meeting and will try to join and catch up if you so allow. Thank you, Your Honor.
Yes, sir. We'll recognize them, and that's precisely why ang ating pong mga association ay invited today. Kasi minsan pag statistics ang pinag-uusapan, para bang everything is well, di ba? Pero pag katulad nung ni Mario kanina na tricycle driver, when we go to specifics, di ba, ng mga membro nyo na may karanasan nga talaga sa hindi makabayad, hindi matreat, or hindi makapag-MRI, or hindi makuha yung bypass, dito pumapasok talaga yung how do I put it, impetus natin that we have to do better, no? So sir, may magsasalita pa from your side right now? We'll recognize them.
Yes, sir.
Yes, sir.
Okay.
Yes, sir.
Yes.
Honorable Senator Cayetano, magandang hapon po at maraming salamat na nabigyan niyo po kami ng pagkakataon na ito. Magandang hapon din po sa ating magigiting na Senador, Senadora Pia Cayetano at si Senador Bongo at sa mga kasamahan kong manggagawa sa publiko. We at PGEA had outlined 7 points that needs to be acted upon or looked upon. Number 1, the benefit. Number 2, the contribution. 3, fund management and investment. 4, accreditation. 5, service delivery. 6, structure and organization. And the last one is to amend Philhealth Chapter. Sa number 1 po sa benefit, may mga napansin po kami. Ang unang-una po ay ang kakulangan ng pagsasagawa ng pagsalaganap ng ang Philhealth package na Philhealth Konsulta. Napakaganda po itong ginawa nyo. Ito ay isang bagong package na konsultasyon na sulit at tama. Ngunit ang problema po ay sa baba, sa mga rank and file at sa community, ay hindi po sila aware, leading to non-availment of the package or low utilization. Ang pangalawa din naman po under benefit ay sana po meron pong pagkasama-sama or pooling of government agency fund budgeted for annual medical check-up of government employees. Narinig nyo na rin po kanina at kayo na rin po nagsabi, Honorable Chairman, na ang mga manggagawa ay nagkukuha pa po ng ibang health card. Ay ito na naman ay isang pasakit sa mga bulsa ng mga manggagawa. Ang pangatlo naman po under benefits ay ang implement the Philhealth Plus. Dati po may mga studies na po ang Philhealth at itong mga studies na to ay found out to be beneficial for the members, yung Philhealth Plus. It can maximize government offices' budget on additional outpatient medical benefits. This can be used to expand outpatient benefits. Ang apat naman po under benefits is para nga lumawak po ang ating outpatient benefit, may isama po ang rehabilitation, treatment, or intervention. And we all very know that the most common occupational hazard would be the low back pain caused by proper body mechanics at mga arthritis sa likod. At dumadami na po ang nangangailangan ng treatment ng rehabilitation at iba pang outpatient care na hindi po covered sa mga existing benefit packages. And fifth, for the benefits, would be the non-availment of benefits due to problems of Philhealth on delay or non-payment to hospitals and doctors where patients suffers, especially during the pandemic. Totoo po ito at marami pong umiyak, marami pong kinuha ni Lord dahil hindi po natanggap sa mga ospital maski membro po yung manggagawa. Kasi ang sabi ay hindi pa po sila nababayaran ng Philhealth. At ito po ay kaawa-awang sitwasyon. At alam po natin, ayaw po natin mangyari ito ulit. At sana ma-review po ito. Ang isa pa pong punto namin na gustong isabihin ay accreditation of hospitals and doctors should be reviewed. Automatic non-accreditation of providers with pending cases of abuse. Accreditation fees charged across to doctors based on percent of income need to be reviewed. They should consider the amount of Philhealth pay or remit to doctors. Most outpatient doctors receive minimal payment from Philhealth. Ang panglima pong nasa bullet namin ay service delivery. Ang gusto po namin iparating dito ay sana meron pong 24 hours public assistance na ma-implement, quick provisions of requested documents and feedbacks within the day, implement as results-oriented IECs, at isasama na rin po natin dito at i-align natin sa universal healthcare na dapat it's a whole of society and whole of government. Isama po natin ang accreditation of non-hospital-based health facilities na ma-accredit po sila. Ang susunod po namin gustong iparating ay ang struktura at ang organisasyon ng Philhealth. Consider lean but efficient structure. Some functions can be devolved to LGUs or DOH regional offices, and some can be streamlined to other government offices with expertise, especially on investment and fund management. At isa pa po ay to amend Philhealth Chapter, members, fund owners should be provided with full education. There is a need to conduct orientation, study the law and other Philhealth related laws, including updates on Philhealth overall operations. Tatawagin ko rin po yung aming kasama sa kanilang 2 punto pong sasabihin.
Man, right before that, ang gaganda po ng punto nyo, but may isang puntong pwede na nating sagot right now. So as far as the public assistance, may sistema na ba ngayon? So for example, no, may I think ang concern ngayon is sa government, no. May isang government employee, let's say police, 'di ba? Nasaksak na barel sa ospital, may problema, so inasikaso naman ng ospital pero 'di ba, hinihingan halimbawa ng who do they call and ano bang assistance base natin? Is it based sa hospital, na sa malasakit center ba to, or meron tayong call center ba? Anyone from the Philhealth family can answer.
Mr. Chairperson, at present we have the call action center, meaning any 24 hours, any member, any patient can call that and ask about Philhealth. So it's a 24-hour operation. The number can be found in our website. It's easily available. We also have these PCares. PCares are nurses that are assigned in hospitals, and their duty is to facilitate help the patients when they have questions on PhilHealth availment, PhilHealth benefits, and processes concerning PhilHealth. So we have these two programs, Mr. Chairperson.
So that we don't argue whether it's effective or not, with your permission, magbuo tayo ng isa din technical working group with the associations.
Yes.
Let's simulate it. Diba? So let's say na nasa Parañaque yung isang pasyente, nasa Tawi-Tawi yung isa, nasa Baguio yung isa, may nangyari. And with your representative, either tatawagan nila doon or kung may empleyado sila na nandun. Diba? So kung nag-earthquake drill naman tayo, mag-Philhealth drill tayo. Not for the purpose of pointing fingers, but to see nga whether effective at kung kulang, paano punuan yung sistema. Ha? Kasi bottom line dito is simple lang eh. Pag nakuha nung humihingi ng assistance yung assistance, pasado tayo. Pag umikot-ikot sila at hindi na makuha, hindi tayo pasado, di ba? So we don't argue here kasi di ba we can present cases that didn't work, you can answer na most of it works. Yun ang problema ko sa statistics eh. It doesn't always show what's really happening on the ground. But of course, it's numbers, so you can't also argue with it, no? So ma'am, kung payag ka, at yung mga asosasyon, di ba? We'll do a simulation, di ba? Na biglaan, na without warning to those group. But together with Philhealth, para hindi parang our word against their word or their word against our word, na? Tapos ma'am, paki-introduce yung colleague nyo na magbibigay ng 2 points.
Yes, thank you, Honorable Chairman. Can we call po yung kasamahan namin sa Union ng mga empleyado sa National Treasury, Sir Rainier? You can have the floor.
Yes, thank you, ma'am. Good afternoon, Chairperson Senator Alan Peter Cayetano, Senators Bongo and Pia Cayetano. Magandang hapon po at magandang hapon din po sa ating lahat. So, again, PGEA is here to support the planned policy reforms necessary to strengthen the delivery of PhilHealth services, including its health benefit packages available for all government personnel and their dependents. Mr. Chair, just one point for consideration. One possible impact of an increased coverage of PhilHealth benefits would be an increased contribution of the members, as it may possibly need additional funding on the part of the PhilHealth. Now, in case members' contribution will be increased, for example, from 1,500 to 2,000, the problem there is, can the government workers afford such increase or additional premium based purely on their current net take-home pay? So the only thing, Mr. Chair, that we are worried of is the probability of increasing the employee contribution as part of the program on policy reforms. So maybe, Mr. Chair, one measure is to increase the sources of income due to PhilHealth, like the share in the excise taxes on tobacco and liquor based on the sin tax law. And of course, the counterpart funding of the national government from other sources. From there, Mr. Chair, we may no longer need to resort to an increase in premium payments on the part of government workers. So, having said that, we recommend that this matter be also taken into consideration in the formulation of the reforms being planned, Mr. Chair. Maraming salamat po.
So very well taken and I understand, no? At ang just to clarify yung binabanggit ko kanina, those who are already getting a second or another healthcare provider na private, so whether GOCC yan or kung ngayon hindi na pinapayagan, Senate, House, Malacanang, or whether in their individual capacity. So for example, sa PNP, siguro kung may konting pera yung general, baka kumuha na rin siya for his family. So ang point ko lang naman, kung ang PhilHealth meron premium Kaso sa magdalawa, makakatulong din to sa PhilHealth. But you raised good points about yung income, yung share nila sa sin taxes, and of course, yun nga, sa ordinaryong manggagawa, hindi rin sila pwedeng maiwan. Ang pinupunto ko lang talaga is two things. No? Number one, there are government employees who are more vulnerable than others. Diba? In fact, some of them, ang problema are not considered government workers. Example dyan is barangay health workers. Dahil allowance lang sila or JO, hindi sila under GSIS at hindi sila considered government. So hindi sila automatic na binabayaran ng LGU sa PhilHealth. Pwede ba silang voluntary? Pwede silang voluntary, no? Oo, di ba? Yeah. Unlike sa GSIS, hindi sila pwedeng voluntary. So ang ginagawa ng LGUs, sa SSS sila pinapasok kasi hindi sila sakop ng GSIS, no? So the second point that I wanted to make nga is that rather than mapunta sila sa private, because nga iba-iba yung regulasyon natin, di ba? So parang nagkakaroon ng VIP system sa gobyerno that there are some offices that allowed na kumuha ng health insurance, yung iba hindi. At wag po kayong maiinggit sa Senate at sa House kasi ang solusyon is hindi tanggalin dun sa mga meron. Kung hindi, paano pagandahin yung wala, di ba? So before kinotion na ako na wag sabihin na some offices, let's say ambassadors, are getting better pay. Kasi ko hindi naman solusyon na ibaba yung pay nila. Ang solusyon itaas din yung sa iba, no? So thank you very much PGEA, and we do now have Dr. Grano of the Private Hospitals Association. Sir, before you went online, yun na, nabanggit na rin po ng Philippine Nurses Association yung delay sa payment sa private hospitals, and we expressed our gratitude sa lahat ng private hospitals, especially during this pandemic, sa lahat ng sakripisyo nyo. And of course, bago yung mga official natin sa PhilHealth, but we want to get a sense then na are we moving forward? Mas maganda na ba ngayon yung singilan or sobra pa rin po ba ang delay? Because na-articulate po ng ni President Miranda that any delay in the payment, delay din yung sweldo ng mga doctors, nurses, at even yung mga janitor, security guard sa mga hospitals. So sir, sa inyo ang floor for any statement and an opening statement po, sir. And any issues, sir.
Thank you po, Honorable Chair and the Honorable other Senator, Senator Bongo and Senator Cayetano. Good afternoon po, and also to our friends from PNA. Thank you very much for giving out the list of our concerns. Pareho po tayo ng ating mga concerns. And para huwag na po tayong masyadong humaba, thank you na ibigay po ninyo ang mga concerns ng ating mga healthcare workers. Siguro po, doon po sa ibang kagrupo din natin na nandito, maraming salamat po. And good afternoon. Yun lang po siguro ang isang concern namin is of course more on the review of the quasi-judicial powers of the PhilHealth. No? Right now, yun po ang medyo concern namin because for us, they are the accuser, the prosecutor, the judge, and the executioner at the same time. Kaya medyo parang nawawalan kami ng powers na are they even under the laws or regulations of the land? Of the different agencies, not even, you know. And then another concern po siguro namin right now is, of course, yung being the biggest insurance group in the country or organization in the country, are they even under the power and control of the Insurance Commission? Mukhang, I think when they were asked, they were saying that they're not even under the powers of the Insurance Commissioner. And then, of course, answering your question, Your Honor, yes, slowly we are being paid by our partners, Attorney Eli and Mr. Bacaresa. I can see you there present. Ano. Thank you very much po dun sa mga tulong nyo sa mga hospitals natin. Although hindi pa po lahat nababayaran. ng ating PhilHealth, but they're, I think, trying to pay us slowly. And so, yun lang po. Siguro, we are expecting na sana ay madagdagan pa yung mga reimbursement claims namin na still nandun po sa kanila. Yun lang po, and thank you very much.
Thank you for this, sir, and we will take that up one by one. So lahat ng points ng ating mga resource persons ngayon will be listed, tapos isama-sama natin. Yung kaya, sir, gawin sa isang technical working group para mas mabilis, gagawin natin. But maybe sa next board meeting nyo, Sir Tony Santos, you can take that up na ano bang maluwag to everyone na yun nga. Kasi you can't really be the accuser, the judge, and the implementer nung penalty in one. During that time po, at ito po yung binabanggit ng mga asosasyon, yung pong mga anomalya sa Philhealth. I think I was speaker when we had the hearings. Yung 2 cents ko doon, sir, doctor, was something like this. Kung halimbawa yung isang ospital may gumawa ng kalokohan, tapos hinold mo yung payment, lahat na ng pasyente at buong ospital na nagsasuffer. Pero kung kasuhan nyo na lang kung sinong gumawa nun, so it's different kasi kung yung fraud was perpetrated by the organization, by that whole hospital. Diba? And it's different if there was 1 or 2 people there. So for example, if you have 1 or 2 people in X hospital na nagpepeke ng bypass, open, close, diba? At sinuspend nyo yung programa. Paano kung 10 yung doktor doon, yung heart doctors, at isa lang ang involved? Di yung siyam at yung pasyente niya, apektado na lahat. So I think this is where yung sinasabi din ni Doc na sino yung accuser, sino yung judge, etc. But of course, sir, I think we all also don't want na yung halimbawa mapunta sa korte tapos umabot to ng 5 taon, 6 na taon bago na yung administrasyon. Wala ring mangyayari doon, no? So maybe together we can find a way nga na ano ba yung best. So kung meron kayong report na may anomalya, so kung kayo din yung accuser or you appoint someone who will accuse, sino yung tribunal na what you call this, na impartial? It doesn't have to be one person. It could be one representative from Philhealth, one from the private hospitals, and one neutral person. Parang dun sa ginagawa yung arbitration. No? It could be arbitrations. I mean, abogado naman sa yung ating bagong OIC. So, it could be more arbitration style rather than, or more small claim style, di ba? Rather than a full-blown hearing. But I think that's a good issue to address. And again, there's no perfect solution, but we can have a pilot on that, no? But I want it to be a board decision from your or board recommendation. Maluwag din sa inyo. Then we will go to the associations, di ba? Whether sa manggagawa or sa private hospital, kung acceptable din sa kanila, then we can have pilot projects about it, di ba? Kasi kung hindi, ganun din tatagal, will accuse each other, then aabot din sa korte, then kaharap naman na, I mean, it's unfair for us to accuse you of something that people 5 years ago did. But on the other hand, hindi na namin sila madala dito. Kayo na yung kaharap, di ba? So any kind of adjudication that can be done very quickly and decisively, yung matatalo dyan will always, not accept it. But as long as fair at transparent and very decisive, ibig sabihin mabilis yung decision making, why not, di ba? So again, to my statement kanina, kung sasabihin mo sususpindin mo kasi program nila pero 5 days lang halimbawa o 3 days kasi maghi-hearing ka agad at isang hearing tapos yan, I don't think aangal yung ospital. Pero kung masususpend for let's say 6 months, ang tumatawag sa amin actually hindi naman yung doktor hindi rin yung may-ari basta ng ospital ang tumatawag din yung mga pasyente din di ba na kasi nga wala na silang, and there are places that isang ospital lang ang credited sa kanila, hindi naman parang Metro Manila ang lahat na pag nasuspend yung isang dialysis center or nasuspend yung isang ospital, marami kang ibang tatakbuhan. Am I correct there, sir, doctor? No?
Yeah.
May mga lugar
Yeah.
na limited yung hospital talaga at saka yung beds dun sa hospital no? No.
Yes.
Sige. Thank you, sir. Anything else, sir?
Yun lang po. Thank you
Okay.
po, Your Honor.
So now we go to the PNP. Kasama po natin si Brigadier General Robert Rodriguez, Directorate for Personal Records and Management, DPRM. Yes, sir.
To the chairman, Honorable Senator Alan Peter Cayetano, to Honorable Senator Pia Cayetano and Senator Bongo. With me, sir, is Police Colonel Jezebel Medina, the Director of the Health Service, and also Police Colonel Richard Fredo, the Chief PNP General Hospital in Camp Crame. In behalf, sir, of the Philippine National Police, we would like to thank the good chairman for inviting us as resource person, and the 227,000 strong PNP organization, who are all members of the Philhealth, are looking forward for a more reliable, convenient, and efficient delivery of services by the Philhealth, in as much as just like in all uniform services, our job is risk and very stressful. Marami po sa mga pulis natin, sir, ang mga sakit ay dulot ng stress. Diabetes, sakit sa puso, and we are always looking the financial requirement of this sickness. That's all, sir, for the
Sir,
PNP.
quick
Thank you, sir.
question. So do you agree, sir, with the assessment na at least sa PNP side, no, na malaking tulong ang PhilHealth pero kulang talaga?
Yes, sir. Yes, sir.
So right now po, pagka meron pong, wag na yung general health, no, yung lang halimbawa po in action, halimbawa na barel, na saksak, or may sumabog na bomba, no, our PNP personnel feel free to rush them to the nearest hospital, or nandun pa rin sa isip na saan yung mas murang ospital na pagdadalan sa kanila?
Hindi na, sir. Kasi we have also this system in the PNP where we reimburse hospital expenses, especially of combat injuries. We reimburse the whole amount that they spend in the hospital. So, kahit saan, sir.
From PNP funds yun, sir, no?
Yes, sir. Yes,
So, over and above yung kaya ng
personnel
nasasagutin ng PhilHealth.
Yes, sir.
Yeah.
Over and above, sir.
So let's say if it's a gunshot wound and sabihin ng PhilHealth, they'll pay for 50,000 pero yung bill is 100,000, PNP will pay for the 50,000.
Yes, sir. For combat injuries, sir, and for ordinary health problems, maximum of 100,000, sir.
So sa general health po, hindi.
Yes, sir.
So for example, sir, ayun nga, let's use yung bypass, no? Kasi stressful talaga, hindi lang stressful mentally and emotionally, but physically stressful yung inyong trabaho. Kasi unang-una, hindi kompleto tulog nyo. Because you're in duty 24/7. Di ba? Many people don't realize na kahit nasa bahay kayo, hindi ka na kayo na yung uniforme, nakabakasyon kayo, kung alam kayong pulis kayo, you have to respond, di ba? So assuming, let's say, ang abutan niyang ospital, kailangan ng emergency na iba-bypass, let's say, is 850,000, pero 550 yung allowed ng PhilHealth, you'll give them an additional 100. Tama po ba?
Yes, sir. Additional
Hindi combat.
kahit hindi, basta hindi combat, sir.
Oo.
Maximum of 100.
100. So may
Yeah.
kulang pa rin, assuming
Yes, sir.
in that example na 850 yung...
Yes, sir. Kulang pa rin, sir.
Oo. About, sir, dahil nandito na rin yung resource persons, di ba? So, ilan na bang hospital o clinics ng PNP, and are they all PhilHealth accredited na?
In Camp Crame, sir. In PNPGH, sir. And in Cebu, Davao, we have primary level hospital, sir. And in Camp Crame, sir, dun po talaga yung hospital po ng PNP, sir.
Cebu, Davao po, sir, Philhealth accredited na rin or in process?
Sir, excuse me. Sir, good afternoon.
Yes.
All our regional medical and dental units, some are accredited but infirmary level. We have in Cebu and in Davao, they are hospitals po, sir. So we have only one level 2 hospital which is in Camp Crame, sir.
Kasi I remember nung SAF 44, di ba, bumisita ako doon. At that time, wala kayong CT scan, MRI. But I remember President Duterte, I think, put some money in, no? But meron kayong CT scan sa Krame?
As of now, sir, wala pa po, sir.
Wala pa rin. MRI?
Yes, sir. Pero po, sir, pinaplano na po, kasama na po sa program.
Pinangungunahan ko lang, di ba? But di ba meron kayong programa na pagka ginagamit yung Philhealth, you also give equipment? Wala na yon. Wala na yon. Nung umpisa ng Philhealth, may ganun kayong programa na pagka kino-compute nyo yung use, ano pa? Wala na ngayon yon. So purely you're dependent on either the DOH budget or the PNP budget for those equipment. Yeah. Bigyan niyo yung list. Tama-tama kasi budget hearing. But sir, baka pwedeng may assign din ng Philhealth sa PNP at AFP and other uniform. I-assess nyo na yung kanilang facilities at ibigay nyo kung anong equipment. Isang birahan na lang sa budget hearing kung kaya rin lang naman. Di ba? Ganun din naman eh. Kasi kung kailangan, alam mo, sa Krame, kung kailangan nila ng MRI o ng CT scan, dadalhin pa nila yung pasyente kung saan, sisingilin din naman sa sa Philhealth eh. So mas mura pang doon na lang talaga meron, no? Of course, meron din yung construction, no? Dahil yung specialized yung rooms for those, no? Can we do that, sir? Can we assign someone to them and do a joint assessment na?
Yes, sir. We will do that, sir. We will assign Philhealth personnel to coordinate with them. In fact, sir, we took the opportunity before this hearing to coordinate with our partners in PNP and Philippine Army to address the issues regarding Philhealth. Mr. Chair.
Kasi minsan, sir, ang attitude sa Pilipinas, pag may checklist, imbis na tulungan sila, parang pabalik-balik ay kulang, wala kayo nito, wala ang ito. But wala naman sa batas nagsasabing hindi pwedeng magtulungan para fill upan yung requirements na yon para nga maayos, di ba? Especially when we talk about uniformed personnel, no? So maybe this could be something we can do quickly and together, considering na the BICAM will probably be mid or late November. So we have like a month, no? If in this month at least yung pinaka-basic na feasible, no, na equipment at saka yung mga kailangan sa accreditation, kung malagyan na natin ng pera. While it's true that some of them will need construction, just because we put it on the budget naman, that doesn't mean na January, February, ma-order nyo na eh. So procure, di ba? Ibibid nyo pa yan. It takes also time eh. So for me, and I think there's a COA, na hindi nyo pwedeng i-bid yung structure together with the equipment. Hiwalay din naman ang pag-procure niyan eh. Di ba? So meaning assuming you need additional facilities in some of these areas, pwede mo naman isabay yung bidding or mauna ng konti yung construction and then pagdating ng equipment, basta't naman hindi masira kung ginagawa pa yung facilities eh, di ba? Go ahead, sir.
Actually, sir, the PNP is now building two level 3 hospitals. One in Bikutan in CRPO, sir, Taguig, with a 200-bed capacity, and one in Panopio, sir, in Quezon City, Cubao, Quezon City, sir, with a 300-bed capacity. Included na po dun, sir, yung mga gamit, which I think parang for bidding.
Yes, sir.
Na ang delivery is after 2 years pa, sir.
Sige, so let's work together and I think that's a better plan, no? Kasi nga, mas madali pag yung hospital is planned from the ground rather than kapag ka may building na binigay and then we adjust it na. So, to our colonels, meron po pang gustong idagdag or is there any request?
Sir, actually, we talked with the Philhealth a while ago that our way forward for the PNP at the regional levels is just the laboratory, basic laboratory with the X-ray and the consultation. Yung parang ginawa po ni Sir Mayor sa Parañaque. I think that's the best for us because ang mga kampo naman namin sa PNP is within the urban areas. So, pwede po yung referral to the DOH hospitals.
Actually, kung ayaw natin maniwala sa mga doktor, kahit mga mekaniko ang ating i-konsulta, di ba? Kasi walang mekaniko na hindi magsasabi sa yung i-check nyo yung brake fluid, i-check nyo yung oil, i-check nyo kung ano, di ba? Pero tayo, hindi pa pinilit, hindi pa gagawin yung every 6 months na blood test, yung every year na x-ray. No, but ako, I'd like to encourage that talaga. And if there's kulang ng funds, I'd like to be a part of helping you secure that. Kasi yung sa blood test lang, marami ka na malalaman kaagad eh. Di ba? Yung liver, kidney functions mo, yung cholesterol, yung sugar, di ba? So, pero pag hindi mo alam yan, and then pag sumama na pakiramdam mo, saka mo tignan, actually, yun yung sinasabi ko kanina, sir, mas malaki pang gastos sa Philhealth eventually. I mean, dialysis is a good, is a good, and diabetes, di ba? Marami kasi hindi nila alam nung pag-borderline na na mag-lifestyle change sila no? Thank you very much, sir, for that. No? But that's precisely why I like face-to-face and committee hearings kasi it's not only what's done formally, but what's done informally, yung magkakilala at saka yung mag-exchange ng numbers para madali nga magtawagan na lang.
Sir, regarding doon sa dalawang hospital namin, sir. As of now, sir, nagkaroon na ng joint ang Congress and Senate, yung House at saka Senate on the reorganization of the PNP. Our problem now is the two hospitals that we are building. Ang structure po ng health service namin is not good enough na iman yung dalawang malalaking hospital na ito, sir. And as of now, sir, nag-joint resolution nata yung House and yung Senate doon sa reorg ng PNP, sir. So I just hope, sir, na baka matulungan kami ng good the honorable senators.
And maybe you can take a look at how yung mga katulad ng lung center, NKTI, heart center, yung board nila. Diba? Tama ho kayo doon na building it and running it are two different things talaga. Akala ko sasabihin mo building permit ipaabot ko lang sa ating mahal na mayor pero okay, so the next is sa AFP, we have Colonel Jonah Dalagit, Chief ng Viluna.
Yes, sir. Sir, good Chairperson, Senator Alan Peter Cayetano, online, our Senator Pia Cayetano, and Senator Bongo. Good afternoon, including the resource person present around. Sir, I've been working in the military treatment facilities from the Visayas, Mindanao, and here in Manila for almost 25 years. And I saw a lot of battle casualties. And I also saw how Philhealth helped us. But the number of hospital stay, that is 45 days for battle casualty from the start of the operation up to the time of recuperation is not enough. So I guess there should be provision to extend the number of hospital days per battle casualty, sir. And then, in a government hospital or any hospital with that matter, we are required by the Department of Health to admit indigent patient, about 10%. So in AFP Medical Center, I saw the package of about sepsis with chronic disease that is 22,400 only, and we incur about 1 million. So we shoulder the almost 900,000 no balance bill with the hospital that is supposedly allocated for uniform personnel. And one is, I was just brought it during pandemic because we open a lot of isolation facilities, so we lack this personnel to man, and our administrative was lack of personnel to do the papers. So we have a lot of claims that is denied because the number of allocated for the PHI is only 6 days, although we give us 120 days, so it's not yet enough to reconsider the documents or the charts, the patient that are claimed for PHIC. So we appeal that for reconsideration, we were given enough time to reprocess to the unclaimed Philhealth documents.
Sige ma'am, so let's work on that. I would ask Attorney Santos after the presentation kung paano nga kino-compute yung sa packages kasi again, nakita natin 22,000, 1 million. And secondly, tama po kayo ma'am kasi 'di ba if you watch the movies about especially Western military, pati yung rehab nila alagang-alaga
Yes.
talaga. More ang nagiging problema nila pag veterano na. Di ba? Na hanggang saan ang kanilang life insurance at saka health insurance. Pero while active duty sila, lalo kung in the line of duty ang kanilang injuries, di ba? Pati yung rehab nila, sagot ito, whether they're inside the hospital or outside na. In fact, yung iba hatid sundo pa kasi nga, well, we have the benefit of having family. Di ba? But we should not also abuse that. Ibig sabihin, may expense din talaga iyon. But ma'am, same question sa PNP. Ilan na ba ang facilities ng... sorry. So you're with Viluna, no?
Yes.
Yeah. But about sa Viluna, kayo po ma'am, nabigyan nung panahon ni President Duterte, di ba, ng for equipment. I remember, nagalit siya nun dahil nga matagal ba ang DOH o ano sa pagbili, no?
Yes.
But how are your facilities there? So mga MRI, CT scan?
We already have those
Yeah.
facilities, sir, and even the hyperbaric chamber. We are 1,200 bed capacity at tertiary hospital with specialty training. So, sir, we have enough actually from the government. It's only the implementation, and we're doing it better now. And we are receiving a lot of equipment. We also have this ER and R complex, which will be hopefully opened next year, with the equipment amounting to 1 point.
So ang main nyo talaga ma'am yung packages, no?
Yes, the
Kulang.
packages. It's not really enough.
Oo.
And then, sir, it's not only the problem here because Viluna Medical Center has allocation for its clients. However, all the AFP personnel and its civilian employees are Philhealth members, and we are giving PHIC billions of pesos every month. And for now, if you are receiving 80,000 as your salary, that's times 4%, sir. So we are giving 3,200 a month. So it's a big money comparable to private insurance already.
Yeah. So sorry, that last point. So you're giving 4% sa premium?
No, sir. The latest policy,
Oo.
yes,
Premium.
the premium is 4%
So, sir-
of the base pay.
So the ano sir, tama ba that regardless kung magkano yung binibigay na premium, pareho yung package?
Yes.
So yun ang kaibahan nyo sa private. Kasi sa private, kung mas malaki yung premium, mas malaki din yung
Yes.
yung benefit, no? Oo. Oo. Okay, ma'am, we'll just so that I don't clutter their presentation muna. And then baka yung ibang issues na to, I'll talk to Senator Bongo whether he'll take it up sa kanyang committee or mag-join kami, no? Sir, sorry. Is there anyone else before we before we ask the Philhealth to present yung kanilang presentation? So kung wala, sir, please. Yeah. You don't have to repeat, sir, unless you want to give. Yeah. Yes, ma'am.
Your Honorable Chairman, I would like to request recognition for the President of Philippine Government Employees Association. Wala po kasi kanina, she is in an equally important meeting and now she is here and would want to say some few statements regarding the situation of government employees. And personally, thank you. Can we recognize her, sir?
Yeah. Yes, ma'am, please.
Thank you.
Is she online na po?
Okay.
Yes, sir.
Yeah. Welcome, ma'am.
Hello, good afternoon po, Senator. Na-miss namin kayo. At least now we are sure that in Senate, we will be able to see the vigilance of Senator Cayetano. And maraming salamat that the PGA was invited here. Gusto ko lang pong sigurong ihabol. I know the legislative team of PGA was able to share inputs. We have the 7-point issues. So by then, what we just want to impart now is, alam nyo, Senator, sa totoo lang ho, sa dami ng mga meetings sa Congress, Senado, galing ka naman po sa Congress, alam nyo, gaano rin katagal umaabot ang mga pag-uusap dito. If you are to ask government employees or the beneficiaries of the Philhealth program, we we cannot waste time on how we can remedy or how we can address the current issues and problems we are encountering. Alam nyo, we have said issues about contribution. Okay, it's a burden. But of course, walang insurance kung walang contribution. Benefits, we have said, our position there. But at tanong dito kasi, ang pinaka-main yung access. Yung access, we should have enough providers, hospitals, doctors. I mean, up to the park-lang area. Hindi pwede kasi ang nakikinabang o ang naaatendahan lang o ang mga napapangalagaan lang, yun dun nando sa urban areas. Yung rural areas, kawawa po. And then, second, yun dun po sa coverage. Maganda naman po ang sa ngayon na nakikita namin na extent of coverage ng ating mga kasama o ng coverage na sinasakop ng Philhealth para i-cover ito ang citizenry. Pero alam din ho natin na umaasa, lalo na yung mahihirap o yung indigent, doon sa tinatawag na kung pag sinabing indigent ka, nando ka sa charity ward, kahit may Philhealth ka, malaking bagay po ang pagkilala na equality sa pagtingin sa mga pasyente, hindi lamang sa pagtingin ng doktor, kundi pagtrato ng ating mga hospital. Siguro, kasi kung nasa charity ward ka, hindi nga talaga mabibigyan ng so much attention. Kasi konti rin ang doktor at nurses na nag-a-attend sa mga charity wards. Unlike in the private rooms. So, apat po sa fund, I think ang sinabi na aking mga kasamahan dyan ay na-express naman ng maayos. Ang simple lang pong aming sinasabi ay, kung nagbayad ako sa iyo ng piso, I should be getting the equivalent of piso. Diba? So, if government employees now is sharing about 3,000, no, not 1.5 on the average as they said, but 3,000 something in a month. And that should be equivalent to the so-called, sa HMO, baka kaya kong ipambili yan na ng mas magandang benepisyo. So, Philhealth should be able, the program or the amendments of the law should provide more flexibility or more concrete measures that will spell out ano yung kapalit ng pera ng manggagawa in contributing Philhealth. For all we know, the money that is intact in Philhealth is owned by the members, by the contributors. It's not owned by government per se. Once you contribute, government contribute to the benefits of government employee, it becomes, di ba ho, in essence, it becomes the fund of the owners, the owner who are the contributors, and the contributors are the members. Government counter share is equal or parang part of the benefit package. So it's a workers ownership. So I think the law, any amendments in the law should also focus on the right of ownership to the fund. If I may say so, that when I was in Philhealth, I was a former Philhealth employee. Sa totoo lang po, I also sit in the board of Philhealth. Marami pong innovation at marami namang studies at researches na pwedeng i-implement. So, baka pwedeng in this amendment of the law, tignan yung lahat ng mga researches in the past that has taken place and hindi nga na-implement o hindi pa na-testing, wala na. baka pwedeng tignan lahat ito at palakasin yung research arm ng Philhealth. And as to ano lang po, gusto ko lang sabihin, Chairman, Senator Cayetano, and Senator Pia and Senator Bongo, pwede po ba na yung pag-aaral na ito para baguhin ang batas na isang pagkakataon na napakaganda ay maging talagang ika nga hindi ko masasabi hindi seryoso, mas focus at mas inclusive, meaning to say na in the process, all stakeholder will be considered in the process. Hindi yung kinukonsulta ang manggagawa, pagkatapos makonsulta, wala naman, hindi man lang dinebate kung bakit hindi pwede sinabi ng manggagawa, okay na, nakonsulta ka naman. Wag po sanang ganon, dapat through the essence of tinatawag na social dialogue o tinatawag na consultation, it should be a genuine one. So, paano mapapangalagaan ng isang manggagawa ang kanyang ownership kung hindi niya naiintindihan in toto lahat na may kinalaman sa kanyang dapat pakinabangan. So we're now talking about education, awareness, kailangan dagdagan at kailangan seryosohin. And then second part is, paano kung papangalagaan ng pondo ko kung hindi ko alam saan dinala, paano nagastos, at mayroong mga report. But you know, tama si kanina po may nag-input sa akin, sabi niya tama si Senator Cayetano when he said na everything has to be validated down the ground. Hindi po pwede na dahil sinabi ng isang government agency ito ang performance ko, we take it as it is. We should be able to create a venue wherein to, not only ventilate issues, but also to validate. Kasi sa PGA, meron kaming dulugan ng bayan wherein people, not only the government employees or the community, bayan, yung pong citizenry, ay pwedeng humingi ng tulong kung saan natin i-refer. So, with this, madami hong avenue o sinasabi ko lang vehicle na pwedeng i-concretize at ilagay dito sa batas. Basta, lang po talaga, genuine, maliwanag yung genuine participation, genuine ownership, at siguro pagbabalik tanaw dun sa mga nakaraan na pag-aaral na pwede naman pakinabangan sa ngayon. Maraming matatalino ngayon, ngunit hindi rin natin iisang tabi ang pag-aaral at ginawa naman ng mga pag-aaral in the past. So, through your tulong, Senator, perhaps all of this will be considered. Creating technical working group is okay, but doing a more focus and more not only participation but involvement. Pag sinabi ko kasi na mag-aral kayo, turuan ng government employees o turuan ng member, hindi lang validation ang kailangan kung nangyari yon, kundi i-test natin kung talagang naiintindihan yan. Kasi kung hindi, hindi tayo makakakuha ng active participation ng contributors who are the owner of the fund. Maraming salamat po uli. Alam ko marami pa kayong pag-uusapan. Thank you po.
Thank you very much, ma'am. Unang-una, well taken po yung consultation should include participation, di ba? Hindi naman to lang yung pasintabi. No, but we really want to have real participation. That's why I also have to consult Senator Bongo kung gusto niyang i-join yung ibang amendments between the Committee on Health and yung committee natin. But let me assure you, we will take this seriously, focused, at saka yung participation. Having said that kasi, almost 200 ang ating GOCCs eh. That's why pina-prioritize ko talaga yung may impact talaga sa buhay ng tao. The weekend nga, daming naglalabi sa akin na i-hearing na rin ng PCSO dun sa nangyaring tumama. Eh, sabi ko, number 2 pa lang yung... So number 1 was SSS and GSIS at we just scratched the surface. Today, Philhealth. Sabi ko, baka ang PCSO, number 9, 18, 27, 36. in multiples of 9. Pero pwera biro, you know, yung sinabi mo ma'am na dapat i-validate on the ground, ang point kasi dito, faith in the system di ba? Ang tingin mo, hindi naman totoo yung Pag-ibig, hindi naman totoo yung Philhealth, hindi naman totoo yung SSS, hindi naman totoo yung Lotto, naluluto, di ba? Pagka ganyan yung attitude ng tao, apektado tayo lahat sa gobyerno. That's why nga ang attitude natin dito, it's not the committee versus Philhealth. Where we're all in this together and kami naman nagpapasa ng budget So kung may pagkukulang, it's not only on your backs, it's also on us. But of course, if there's graft and corruption, di ba, it's our duty to point it out. So ma'am, if I can summarize, right before I give the floor to Philhealth officials, kasi I wanted to finish around 4, a little bit after 4, para hindi naman kayo ma-traffic at makareport pa kayo dun sa babalik pa sa opisina. To summarize, sir, sabi niya, access, coverage, dadagdag ko yung zero balance, zero billing, kasi yung talaga issue. So, gawin natin yung code natin, paano ako A, access, C, coverage, O, yung zero billing. I think, you know, we'll be focusing on that Tama nga naman, di ba, na kahit na kompleto at maganda, kung wala namang Philhealth accredited sa lugar na yan, and some of that will be DOH. As I said, 40% of our barangays do not have primary health centers. No? Yung coverage, yung isa dyan, yung binanggit na kanina nga, yung Philhealth Plus, at saka yung check-up and everything, but also to zero billing. So anyway, the floor is yours again, Tony Santos, and then kung ma-input mo na rin yung narinig mo mga tanong dito. And basically nga, we're interested dun sa zero billing. No? Number one, you know, how do you come up with the amount? Is it an average or do you do a survey? And then number two, yun nga, how do we address those issues na kung medyo pasay na yung amount na yun? No? Right now, napakalaki ng inflation. So I don't know sa healthcare center. I mean, if you ask people about presyo ng bigas, ng langis, masasagot ka kagad. Kayo po magsabi, do you feel this then sa mga laboratories at sa mga ospital? No? Nagtataas na rin ba sila? No? Sir?
Thank you, Mr. Chairperson. Again, good afternoon, Mr. Chairperson, Honorable Senator Pia Cayetano, Honorable Senator Bongo, fellow public servants, colleagues, resource persons, everyone, good afternoon. Mr. Chairperson, this presentation might not be able to cover on target the access, coverage, and zero billing, but we welcome any question about that after the presentation. Please allow us to share Philhealth's proposed programs and corresponding budget requirements for the next year, 2023. And then we'll be updating the committee on the corporation's ongoing initiatives as we gear towards the attainment of universal healthcare. Next slide, please. Our presentation will cover the following contents. First, revenue generation. Second, membership coverage. Third, expansion of benefits, particularly following the UHC Act, then sustainability of the funds, and strengthening of Philhealth as an institution. Next slide, please. The two main fund sources of Philhealth are premium collections from direct contributory members and national government subsidies. Indirect contributory members. From 2018 to 2022, subsidies have formed around 42% of the funds raised. These subsidies are proposed by Philhealth as part of its budget. On the average historical allotment of DBM and eventual GAA-approved budget is around 49.55% and 50.48% of what Philhealth proposed, respectively. Next slide, please.
So in terms of numbers, sir, ilan dyan yung direct na employees at employee? Ilan employees yan? And yung sa national government na subsidy is equal to how many people? Will that be in the presentation later on? Wala.
Wala, sir. It's
Yeah,
not here, but we'll answer that
Anyway,
question.
can you answer that later?
Yes,
Para hindi pera ang tinitignan natin. We're really interested kasi kung ilan ba talaga ang miyembro at covered ng Philhealth.
Yes, sir. May I proceed, Mr. Chairperson? The UHC Act changed the membership scheme to two simple groups, direct contributory and indirect contributory. As of June 30, 2022, direct contributors are 63 million or 64% of the total Philhealth members in the database. Indirect contributors are 35 million or 36% of the membership database. By virtue of the UHC Act, Filipinos are automatically members and covered by Philhealth. The counts mentioned refers to the number of names registered in the database, which is 98 million. From 2023 to 2027, Philhealth is forecasting expansion of both its premium collections and subsidies received from the national government. The pooled funds from PCSO Core, in accordance with the UHC Act, is also seen to substantially contribute to the fiscal space of Philhealth. As Philhealth plans to grow and expand its benefits in the coming years in order to fulfill its envisioned role in the UHC Act, the corporation will also require a commensurate expansion in its fiscal space in order to afford these benefits. Simply put, the expected increase in spending will also necessitate increases in financing. Next slide, please. As to GAA utilization, as of June 30, 2022, Philhealth has already utilized 77% of its GAA allotment. Next slide, please. This is the 3-year income statement of Philhealth. On a 3-year average, around 45% of premiums are from the subsidies of indirect contributors. The reserve fund shows an increasing trend with an average of growth rate of 27%. The investments take the largest chunk, averaging 89% of Philhealth's total assets. The benefit expense of Philhealth took a dip in 2020 due to COVID-19 impact. As we embrace the new normal with quarantine restrictions relaxed, a significant increase in benefits expense can be observed. As of June 30, 2022, Philhealth's premium income is 83 billion, a reserve fund of 188 billion, total assets of 365 billion, and benefit expense of 75 billion. The net income of Philhealth as of June 30, 2022 is 10.1 billion pesos. Despite the challenges arising from the pandemic and global disruptions brought by the war in Ukraine, the National Health Insurance Fund ended the first 8 months of the year with a robust investment portfolio level of 346.6 billion, significantly higher than the 333.3 billion investable funds reported in the same period in August last year. The increase was attributed to a higher premium collection. Again, the lion's share of the investment portfolio is invested in government securities, accounting 78% or 270.29 billion of the total portfolio, up by 16% from 233.69 billion in August 2021. This is followed by special savings or high-yielding deposits placed at 75.28 billion, comprising 21.72% of the total investable funds. While the remaining less than 1% of the portfolio of 1.1 billion consists of AAA corporate bonds, investments in the Ayala Property Arm, Ayala Land Incorporated. The special savings deposit level is lower by 14% compared to last year's 87.59 billion, since certain portions of the proceeds from maturing placements were reinvested in days-to-go government securities, where the corporate bonds investments finished off with a lower balance from 12.01 billion from the previous year's level, seeing that the number of corporate bonds investments matured and were redeemed last year. Also, there were no new investments in corporate bonds pending the finalization of the revised policy on corporate bonds investment. Next slide, please. For 2023,
Sorry to interrupt. I just want to thank the Majority Leader, Senator Joel Villanueva, for making time. Actually, papunta na siyang Bulacan, but nung nalaman niyang Philhealth, he went back to the Senate. So thank you for that, Senator.
Thank you, Mr. Chairman. Of course, here to support
our dear chairman, brother in Christ, Senator Cayetano, and of course, Philhealth. We know that you need a lot of support, and we are here to help in any way we can. Marami na tayong mga naririnig na kung ano, especially mga chismis, alam naman natin yun, no? But we are here to help, and hopefully makatulong. But I would only say na you're in good hands with Senator Alan Cayetano. That's for sure. Thank you.
Walang representative ngayon yung athletes, pero si Senator Joel na yan kasi suki na ang tawag sa kanya dun sa MRI at saka pag-opera sa tuhod sa basketball. But that's an example because what we're discussing, Senator, is yung coverage, yung access, at yung zero billing, di ba? Kung, how do I put it? Kung may tapang ang ordinaryong Pilipino sumugod sa ospital, na uuwi siyang ginamot siya at lahat ng treatment na hindi niya kailangan maglabas ng pera. No? Siguro that's the gist of it. Sir, please continue. Sorry for the interruption.
Thank you, Mr. Chairperson. Good afternoon, Honorable Senator Joel Villanueva, sir. For 2023, PhilHealth proposed a total subsidy of 134.75 billion to cover indirect contributors. This includes indigent families and households, senior citizens, persons with disabilities, and other special groups that are mandated by legislation to be subsidized. Following the UHC Act, premium rate of 4.5% for the income floor of 10,000 pesos, this translates to an annual premium rate 5,400 for these subsidized individuals. The DBM approved amount is 79.06 billion or 58.67% of original proposal of Philhealth. Philhealth also proposed separate additional funding of 34.99 billion to be sourced from the pooling of funds from PCSO Core. This is for the improvement of benefit packages following the UHC Act for a grand total proposed of 169.74 billion. The DBM approved amount for benefit package improvement following the UHC Act is 21.17 billion, which is 60.5% of the proposed. This brings the total DBM allotment to 100.23 billion, which is 59.05% of the proposed. Next slide, please. In terms of benefit payout, we see a consistent trend in inpatient payments versus outpatient payments. This is based on a study done by the Philippine Institute for Development Studies, or PIDS, in 2021. Which processed and analyzed around 60 million claims data from 2015 to 2020. On the average, 90% of PhilHealth benefits are toward inpatient payments. These are more or less equally distributed across levels 1, 2, and 3 hospitals. Infirmaries constitute the smallest share at around 4%. Outpatient payments only constitute around 10% of the benefit payment of PhilHealth in this period. Majority of these are paid for outpatient hemodialysis, benefits for maternity care, and family planning. Both account for around 4% of the 10%. The baseline primary care benefit of PhilHealth only account 0.001%. This shows a familiar trend within the entire health sector, where much of the resources and attention go to tertiary care. With the UHC Act, payments of inpatient care will be rationalized and improved. Benefits for outpatient care, on the other hand, will be prioritized and expanded. Next slide, please. As you can see, PhilHealth has already processed and paid majority of the received claims in the last 3 years, where 75% of the received claims in 2022 are already paid and 12% are in process. We'd like to assure the Senate and this committee that there is no cause for alarm. PhilHealth receives an average of 1.2 million claims a month. Multiplying this by the average value per claim of a little more than 10,000 pesos, it will give us a total amount of 12.5 billion pesos of claims payment per month. Hence, the value that was raised during the budget hearing with the Committee on Finance is just about a month's worth of claims on hand. At any point in time, PhilHealth will always have about 10 to 15 billion pesos worth of claims in process. Next slide, please. Currently, the benefit for primary care is through Consulta. Consulta covers a limited select set of 13 laboratory services, 21 medicines, plus consultations, preventive services, and referrals, which, with the UHC Act, the vision is to provide a comprehensive outpatient benefit package for all Filipinos, the COBP. The COBP will not be limited in what it will cover. Instead, it will cover and pay for all essential drugs and laboratories within the standard of primary level or outpatient level facility. For inpatient services, the prevailing payment system is through the all case rates or ACR. Through the ACR, internationally classified and standard medical and procedure interventions are assigned a corresponding fixed rate. In effect, all inpatient services are covered. However, these rates have been deemed insufficient, as was related to us a while ago by our resource persons. With the UHC Act, the ACR will shift towards diagnosis-related groups. Here, all inpatient medical and procedure interventions will be covered. Furthermore, will be grouped together for appropriate diagnosis and costed more appropriately. These transitions to UHC and vision benefits will happen through phased implementation, where year-on-year growth will be incremental. For primary care, the intended approach is that increments of 25% of the population should be covered until the COBP is implemented and everyone transitions out of consulta by year 2027. For inpatient care, the intended approach is that rationalization to DRGs will be done for increments of 25% from top claimed cases until the entire ACR is phased out. Next slide, please. Aside from the shift towards COBP and DRGs, other special benefits are also in the pipeline. This is a mix of expanding current benefits for and introducing new ones. Benefits for certain cancers, hemodialysis, transplants, and select surgeries will be expanded, while new benefits on malnutrition, physical medicine, and rehabilitation, and mental health will be introduced. You can see here also the projections on how much will be the year-on-year benefits cost of shifting to COBP and DRGs, as well as establishing these special benefits. These incremental shifts will lead to full maturity for all benefits come 2027. UHC Act mandates Philhealth to become a national strategic purchaser of individual-based health goods and services. Next slide, please. Next slide, please. If we follow a scenario where Philhealth receives what it proposes throughout, benefit expense will overtake income by 2026, where the yellow bar exceeds the green bar. This means that the same 2025 benefit level will continue to be implemented as represented by the red bar. Here, 75% of Filipinos can receive the comprehensive outpatient benefit package. For inpatient, the ACR will continue to be implemented. For special benefits, the benefits for malnutrition will continue, but the benefits for hemodialysis and mental health will be maintained. In the ideal scenario that Philhealth receives what it proposed until 2027, it will be able to reach the maximum benefit level of 2027. The reserve funds will have to be tapped as represented by the blue bar. The financial health of Philhealth will still be intact. Reaching this full maturity in benefit levels means that all Filipinos can be provided the COBP, the DRGs will be fully implemented, and all enhancements in the special benefits will likewise be completed. Overall, Philhealth will continue to develop its benefits in accordance with the UHC. However, the continuing expansion towards and rollout of these benefits will also depend on the resources of Philhealth. The National Health Insurance Program will continue. The more resources we have, the more benefits we can also put out. Next slide, please. In order to better perform our mandate, Philhealth will also be strengthening its institutional capacity. In 2022, some of these have already been initiated, but are expected for continuing implementation this 2023. These institutional strengthening activities will also necessitate resources to implement. For this coming 2023, we propose continuing the additional 2.5% covered administrative cost for a total of 7.5% as allowed by law. The 5% administrative cost rate will total to around 8.6 billion. This should be able to cover standard PS and MOE costs. Sorry. The additional 2.5% will translate to additional 4.3 billion. The 523 million of this is targeted for improvements in the office, its logistics, core operations such as collections, and externalization activities such as information and education campaigns for UHC. The compensation and position classification system, or the CPCS of the GOCC, or the GCG, will also be continuously implemented, which introduces salary adjustments based on EO 150. The 2.5 billion will be for the ongoing reorganization of the structure of Philhealth. Once completed, this aims to revitalize the different units, staffing patterns, as well as work dynamics of the corporation to respond better to each UHC mandates. The 211 million will be for digitization and IT enhancements, which are also major areas of institutional strengthening. Fraud detection,
Ay, hello, yeah, sir. Mukhang okay na yung sound system. Why don't you finish the but then we'll go into that yung membership. Sundin natin yung yung coverage tapos yung access tapos zero billing. Just very Sige sir, para you can finish the presentation. Sige sir, kung papayagan nyo habang wala lang yung screen, pwede ba nating himayin yung yung membership?
Yes, sir.
Oo. May binabanggit kayo kaninang 65 million and 35 million. Was that it? So 65 million paying premiums? Ganun ba yan?
If I may, Mr. Chairperson,
Yeah.
as of August 2022, the direct contributors has a total of 34.6 million.
So
Direct contributor.
34.6 million people are paying.
That's correct,
Okay.
Mr. Chairperson.
Tapos yung indirect, ito yung sa Sinta, ito yung mga subsidies.
That's correct, Mr.
So
Chairperson.
ilan yan?
21.7 million, Mr. Chairperson.
21.
That's
So
correct.
if you add both, it's around 60.
56.4 million.
Ilan pa?
56 for
Okay.
million.
So kung 56 million and if we're 110 million Filipinos, assuming 10 million are abroad, so around 44 million in the Philippines are not contributing muna. Tama?
If I may, Mr. Chairperson,
Ah.
with that membership, we also have dependents numbering to about 43.7 million.
Oh, so kung sama mo yung dependents na 43 million, that's what I was saying kanina, na yung iba, it's yung individual ang member, pero may dependent siya. So per family.
Yes, sir.
So dapat lumabas na 100%.
That's correct.
Yeah. Let me, sir, ha? Sa pananaw nyo, how many do you think sa Pilipino tingin nila, alam nila kung na member sila? Eh, it's not your fault, ha? Kasi panahon pa ni President Era, President GMA, parati 90% members, 85, 95. Pero can you make a guess or a guesstimate if you were to go around ngayon, anong tingin yung tingin ng tao? Ilan sa kanila ang membro? Yes, sir.
Mr. Chairperson, my answer will still be based on the number, and that is the registration rate of 90%. And that means 111.5 million Filipinos are, I'm sorry, 101 million
Yes.
Filipinos are registered.
90% pataas, sir. Yeah. Can you show the Okta slide? So, I mean, that's an intelligent answer and that's by the statistics. Pero ito yung sinasabi kong validation on the ground, no? To use the word nung PGEA, pinasama ko to sa Okta as a rider question nung 2021, okay? Only 43% of Filipinos say that they are members. 60% in Metro Manila, napakababa sa Balance of Luzon, 22%. Sa Visayas, 38%. Sa Mindanao, 61%. I'd encourage you or the DOH sa susunod na SWS of Pulse Asia, isabay nyo rin. Kasi total data-driven naman kayo and science-based. Kasi kahit anong sabihin natin sa tao 100%, kung sila mismo magsasabing hindi sila member. So it goes to my next question. 100% naman pala ng Pilipino ay membro, why would they need an ID? Di ba? 100% naman pala. De pagpunta nila, kasi pagpunta mo, hinahanapan ka pa ng Philhealth eh. Go ahead, sir.
Mr. Chairperson, for purposes of availment of Philhealth benefits, we do not require ID. Right now, at present, Mr. Chairperson, please.
Oh, when you go to the hospital, hanapan ka, tatanungin ka, Philhealth member ka ba, di ba? Tatanungin ka. Ba't ka patatanungin kung lahat naman kayo membro? Diba? So, maraming Pilipino pag puntang ospital, tinatanong, sir, may Philhealth ka ba? And based on this survey, 57% will say, sir, hindi ako membro. Diba?
Yes, Mr. Chairperson, if I may, although we have this automatic or immediate eligibility, but what Philhealth requires is registration. We mandate, we request our fellow Filipinos to register in Philhealth, Mr. Chairperson, because at present, our registration rate is still 90%, meaning there is about 10 to 12 million Filipinos or not.
I wanna finish this hearing without arguing with you.
Yes, sir.
So, puputulin ko dito, and please meet about it. Kasi precisely nga, kung sila mismo nagsasabing hindi sila membro, I mean, I won't argue about registered o hindi, di ba? But ang point nga, and remember kami, dumadaan kami sa eleksyon. And in 2019, nung tumatakbo akong congressman ulit, Scopus yan eh. So pag sinabi sa amin ng Bureau of, yung sa statistics ng labor, na only 7% or 6% walang trabaho, eh umaga, almusalan, tanghalian, merienda, hapon, may kausap akong tao eh. So kung may trabaho sila, wala sila doon. Di ba? Kaya pag tinanong ko, sino dito walang trabaho? Lahat ng kaharap ko eh. So more than 7% ng population yon, unless taga-tagig lang ang walang trabaho. So ganun din ang tinanong ko sa kanila. Pag tinanong ko sa kanila, sino sa inyo walang Philhealth? Napakaraming tatanong. So again, sir, I know you're answering correctly in terms of your statistics. But I'm saying in terms of practical terms, it has to be much easier, di ba? Na pag pumunta ka, so kung all Filipinos are covered, how do we make it easier doon? Iba-biometrics na lang ba natin yan or whatever? You can answer now or hindi, but ang point ko lang, I don't wanna argue kasi so that we can go on to more points, no? But we have to have a better way of them. So you wanna say something? Go ahead po. Yeah.
CEO.
Yeah.
CEO.
Sir, thank you for that, sir. And ano talaga, sir, we acknowledge that there are a lot of people na nagsasabi wala akong PhilHealth. Kahit sinasabi na sa Universal Healthcare na meron siya. So I think that is a challenge, sir, and we will answer that by intensifying our educational campaign.
Yes.
But dun sa availment lang, sir,
But pakitignan nyo rin kasi how can they be registered kung hindi nila alam? Unless yung nag-register yung magulang at hindi alam ng mga
Yes, sir.
beneficiaries.
yes, sir,
diba?
we will do that, sir. In fact, we are embarking on projects with DepEd and ano ba namin ma-register na mapasok. Pero ang ano talaga, sir, crux of the matter is when they need PhilHealth, which is on the point of service doon sa hospitals, kailangan nila doon maka-avail. So, and we acknowledge also,
And I acknowledge that at napakagandang innovation yan. But on the ground, alam nilang kung ang tingin nila wala silang PhilHealth, hindi na sila pupunta sa point of ano.
yes, sir. So,
Marami pa rin namamatay ngayon na hindi tumutuloy sa ospital kasi hindi nila alam na sasagutin sila noon.
opo, we acknowledge that, sir, and we will intensify our educational campaign. But we would like also to let you know na doon sa hospital, sir, naglagay tayo ng portal wherein the hospital personnel can check if they are in the database. Now, if wala sila sa database, they will just have to fill out our
Yeah.
form for purposes naman for the hospital to claim.
Alam mo sir, if I can recommend, wala pong barangay captain sa buong Pilipinas ang hindi gusto na lahat ng kanyang kababayan ay registered. So maybe if you meet with yung samahan, total i-extend naman natin term nila ng 1 year. I think if ganun ka grassroots, of course, mayors, governors, napaka-importante. But I think ang una naman tinatakbuhan talaga nung may sakit yung barangay. So if we do something with them dito sa registration or we do it online or whatever, no? So thank you for that answer. But yun ang point ko, ayoko lang na so it's the 19th Congress, Brad, no? So since 11 Congress kasi tanong ko yun eh. But I'm happy that finally I got a answer na napupunta na tayo sa solusyon. So which goes to the second question. So assuming that they're all members or all they have to do is to register, dun sa zero billing, how do you get the price of the package? Do you do a survey or ano?
Mr. Chairman, can I, but because this is related to what you're trying to emphasize. First of all, I'd like to associate myself to what you mentioned. And with this data that you presented, that 43% of our people believe that they are a member of PhilHealth, so 57% are not. Yung binabanggit nyo kanina, pag pumunta dun sa ospital, tatanungin kung PhilHealth member ba sila o hindi. And then kung member ka, isisingit ko lang, yung World Health Organization's Global Health Expenditure database, ang sabi dito, yung out-of-pocket expenditure as of 2019 here in the Philippines is very high, no? Yung huling record nila, Mr. Chairman, it is 48.56%. And kanina binabanggit nyo nga po yung it's funny because I had 3 knee major surgeries, Mr. Chairman. Suki ako talaga at inabil ko yung buy one take one operasyon sa tuhod. But yung percentage of the major sources of financing accounts for out-of-pocket expenses. So I think it's very important that we also discuss it, Mr. Chair. Thank you.
Last point before we leave there. Di ba yung latest ruling is that OFWs do not have to get PhilHealth? Tama po ba yan? Di ba? So, ibang issue if they should or not, no? But kung ang stand na ngayon or ang utos na is they do not have to, but 100%, so now they're still members. It's just that they don't pay. Diba? So burden din sa inyo yun.
They have to.
Yeah. Pero hindi nila alam na membro din sila. Or yung actually ang angal naman kasi ng OFWs, hindi yung beneficiaries nila, yung sila. Na ba't sila magbabayad kung nasa abroad sila? Kasi sa abroad, magbabayad din sila ng health insurance doon. But ang beneficiaries nila, ang pamilya nila nandito. So yun ang hindi na sort out. Maybe I can sponsor a meeting between Philhealth and Secretary Tuts Ople para we can map out how to really help no, yung OFWs, no? So, can we go there to nga yung sinasabi nga ni Senator Villanueva, yung actual na out of pocket. So, how do we do yung bayarin, no? So, for example, sa dialysis or sa bypass, no? How do you get the amount sa package?
You, Mr. Chair. We have two packages or for the inpatient. One is we are using the ACR or the all case rates. And then we also have the Z benefit package, which is actually covers the catastrophic illness. These are diseases which are economically and medically catastrophic to the patient. So the usual, the current benefit for ACR or the all case rates, these were computed based on the procedure or condition average cost. Ang problem po natin dito is that these were costed in the year 2013 and 2014. That's why there was an manifestation earlier that it is too low because like the 22,000 mentioned earlier on the cesarean section, this is under all case rates. What we want to do here is we are currently updating the costing for this cost case rates. And also for the...
Clarify lang ha. So, good news yun that you're updating and I think you should do it, every year or every 2 years, di ba? Having said that, sinabing average, that's per region, that's private, public hospital, or how do you get the cost? So assuming this was 2013, 2014 and we were doing it, how do we get it?
For the original, it was a national average.
National average.
Yes.
And we know for a fact that then we will have a problem in urban areas kasi mas mahal talaga. And then yung problema mo sa rural, mas mura nga pero baka wala yung facility doon. So when you're doing it now, could you do it per region?
Yes, sir.
Diba? Kasi I don't think it makes sense to do it on a national.
Yeah. Yes, sir. If I may complete also, sir, with regards to the ACR, we are actually transitioning to as mandated in the law to DRG or diagnosis-related groupings, wherein for this one, sir, we will have also to consider not only the location of the patient or the hospital, but also we also take into account the other factors that cause or has an effect on the actual cost of care, which are the age of the patient, kung mas matanda po siya, mas risky siya, so it actually costs more to care for that patient.
Yeah, to be fair naman, yung pinakita natin kanina sa bypass, nakalagay naman doon no complication, di ba? So kung halimbawa diabetic yung magpapa-opera, alam naman natin na there could be extra expenses. But my point, ma'am, is that when we said, kasi if you did not say zero billing, then of course it's just a matter of how much you can afford. And then those who are lobbying na hindi ba pwedeng itaas. But nung sinabi kasi nating zero billing, naniwala yung tao na wala ka nang idadagdag. So how do we reconcile that moving forward? So assuming you're doing now a survey, that will affect the whole presentation kanina. Kasi tataas yung cost nyo eh. So will you roll back on services or you will now say na 80-20 yung billing? You'll take care of 80-20 or it depends sa lalabas sa inyo? I mean, anyone can answer it, but just so that we know what to expect. Kasi if 2013, 2014 yan, at least 20% more expensive now. So if you're going to pay another 20%, that's going to affect all of your computations talaga. Diba? I mean, even without the additional benefits. Yeah. Yeah. Sorry, I don't mean to put the whole world on your shoulder, but I think yun yung natural consequence nun eh.
With the inpatient, sir, moving forward, DRG, sir, or the diagnosis-related groupings, we are currently conducting the costing of all the services. And as soon as we know the actual cost of care, the current actual cost of care, sir, then we will have to set the base rates for all these conditions. And then po, we will, as I've mentioned, consider all the modifiers for the case. And with that po, sir, we will, of course, consider and the actuarials, the financial condition of Philhealth. And after the actuarial study, we will know how much Philhealth can actually pay for the total cost of care, or what is the percentage that we can take care of. And of course, the rest will be for the patient. And of course, sir, we will have to consider also discussing this with healthcare providers and agreeing with them, because what we want is that there, if ever we need to, or we cannot cover everything 100%, the co-payment should be fixed and that the patient would not be charged over and above that co-payment rate.
So, sa akin lang naman truth in advertising, and wala naman administrasyon ang gusto na marinig natin na during your time, biglang hindi na zero billing. We're just thinking ahead. But having said that, hindi ba mas pangit na walang faith ang tao na totoo yung zero billing? So, the thing is, you only have about 45 days more or less, or a month and a half before we wrap up the budget. So your presentation today, Tony Santos, was correct as of today. But as soon as you get the new numbers, para na yung domino na isa-isa nang tutumba kasi magbabago na yan. Diba? As I said nga, if you look at 15 to 25% change sa cost, and napaka-obvious naman yan kasi nga napakatagal, and yung cesarean is an example, no? Yung 22,000 is such a small amount sa act na ginagastos, and I think ang gold standard sa atin would still be heart center pagdating sa bypass, and kung ang package natin is 550 pero sa kanila ang pinakamura is 700,000 na, so more or less tama, di ba? That's about 20, a little bit over 20%, no? So I don't want to create more problems today. We're here to find solutions, but may I leave that with you. We'll have to explain both to the president and to the public that ito nga yung problema ng zero billing. Kasi if we keep advertising it, mag-Philhealth kayo, pumali kayo, zero. Tapos they keep going to the hospital at meron silang ilalabas, di ba? Na-erode yung faith sa sistema at sa gobyerno eh. It's not your fault. You got here, that's happening. You're trying to fix it, di ba? But part of fixing it is telling the people the truth. Na ito ang sitwasyon ngayon, di ba? Zero billing but based on 2013 rates, di ba? So anyway, I'll stop there.
Yeah, I just wanted to make sure that the numbers ay nag-improve na from the WHO's Global Health Expenditure report na 48.56% yung out of the pocket expenditure as of 2019. Siguro naman nababa na natin to ng konti, no? Just wanted to make sure na hindi ito prevailing pa rin because this is 2019.
So while you're checking that, can I ask the question, anong time frame natin for this? Anong time frame natin, ma'am, for looking at the change, the reforms, no? And coming out with the cost per package and everything. Yung pinakamatagal na, of course, kung matapos bukas, bakit hindi? But is it 6 months, a year, or this year, or?
So we have about the remaining months of this year and next year to finally come up with the rates for all of this, and of course the other necessary implementation arrangements. So we plan to pilot this by 2024, sir. And of course, by piloting, we mean, since this is a new system, we want to know first how it will run and learn from it. And if there are things that we need to change, we can change it further.
We understand na hindi kayo pwedeng bara-bara dyan. And as I said, no, parang dominoes yan na nakapila. So having said that, then wouldn't it be smart or could you bring it up sa board nyo? Why don't you do something across the board now? Di ba? Like a 10% or a 15% increase while you're waiting to 2024 para lumapit kayo sa actual, para magbago na rin yung computation so that we can go to DBM. Rather than everyone complaining about you in 2023. I mean, you not personally, but Philhealth, no? So think about that. We have time. We'll have a budget hearing on the floor in November. But I'll go back to the question of Senator Villanueva, our majority leader. Yung out-of-pocket expenses ng mga kababayan natin, is it getting better or ano?
If I may, Mr. Chairperson, Honorable Senator Villanueva, based on our records, on a study conducted in 2019, the out-of-pocket percentage is 34%. Meaning for every 1 peso on health spending, the out-of-pocket is 34 cents.
10% yung naibaba, no?
Yes, sir.
And I hope we have the mechanisms and steps are being undertaken to address this high out-of-pocket expenses, no? And to lower yung within acceptable limits, of course. Yun lang yung sa atin.
But to further his question, yung out-of-pocket na yan, lumiit because mayayaman ang nagbabayad or ang mahirap ba hindi pa rin? Yeah.
Mr. Chairperson.
So, it's safe to say na across the board yon.
Yes, sir.
Because most of our people are poor eh. So pag sinabi natin na around 400 billion ang out-of-pocket, that's totally okay if the rich will do it and they will pay for it because we don't intend naman na pasagutin sa gobyerno yung sa kanila. But if you say 70% of our people are poor at 400 billion, the 70% of that, 280 billion ang out-of-pocket ng mahirap. Di ba?
For me, Mr. Chairperson, just to be balanced about the reporting, there's also a report from the PSA, Philippine National Health Accounts. Our out-of-pocket is still at 44.7% based on the current health expenditure, Mr. Chairperson. Honorable Senator Joe.
We'll hanapan natin yung kasi magkaiba yung kumuha. But ang point ko kasi, yung study na lumabas before na, let's say, again, going to yung halimbawa, yung bypass, no? So yung mahirap, na wala siyang extra 150,000 para mabuo yung 700,000, minsan namamatay na nang hindi nagpapa-bypass. Yung mayaman, kahit yung 1 million na bypass, kukunin niya, i-charge niya sa gobyerno yung 550, 450 yung babayaran niya. And it is right na i-charge sa gobyerno kasi member siya ng Philhealth at nagbabayad naman siya ng 4%. So progressive din naman yung nanggagaling sa kanya na premium at sa employer niya, no? But ang point ko, kaya mas maraming middle class, upper middle class at mayaman ang gumagamit ng Philhealth kaso sa mahirap. Ito yung net effect ng zero billing na hindi kasi kaya, di ba? That's what we have to address with the prices and the zero billing, no? So yan, so that we can come up with some solutions. Maybe you can discuss with your board kung dapat may across the board na adjustment and then bring it up din sa budget. Kasi dininay kayo ng, instead of giving you for 24 million people, for 21 million people ang binigay ng DBM sa inyo. Pero kung ma-update naman sila that it's based on the 2013-2014. Kasi nga, for example, ang DOH, they have a 20 billion for MAIP, which is a medical assistance program. Kung zero billing tayo, hindi natin kailangan yon. Bakit? Kasi walang manghihingi sa DOH ng penging additional kasi pagpunta nila may Philhealth. Kaya meron doon at kaya meron sa DSWD, sa AIX at kaya meron pumipila sa atin kasi precisely nga hindi zero yung billing nila, di ba? Oo.
Mr. Chair. Yes. If I may add lang po, based on the presentation earlier, kasama po dun sa benefits for expansion is on the ACR, wherein we were asking for about 9 billion, sir. This is for the increase of the current ACR that will be implemented next year. So that is even before we go to DRGs. There's already an interim increase in the benefits.
And the costing that you are using is not the 2013,
No,
2014
sir.
cost.
It's
Okay.
a different, very updated cost.
Precisely, ma'am, yung sinabi ko nung umpisa, no, na, or majority leader, yung, pag sinabi mo kasing yung life is only until 26, 27, syempre nagpapanik. Pag hindi mo man sinabing ganon, hindi naman dadagdagan ng pondo. So, very toxic yung atmosphere ng communication no one's listening to each other minsan. So I do agree it's very difficult. Pag sinabi niyong wala ng zero billing, uupakan pati yung administrasyon. Pag sinabi naman natin meron, pero pagpunta mo sa ospital, 20-30% babayaran mo, ano namang klaseng yan. So nandun tayo sa ganun na sitwasyon Dahil karap ko rin si General Rodriguez, I remember, sir, naging problema ng isang namin yon, chief of police. Nag-iba yung there was 1 year na nag-iba yung paano i-report yung crimes So sabi niya, sir, kung i-report ko yung tama, lalabas during my term, dumoble yung crime. Pag hindi naman sumunod ako, sir, galing naman ako kung hindi ko ni-report. So, anong gagawin ko? Diba? Parang damned if you do, damned if you don't. Because nga, there was a reason for doing that. That's why din tayo nag-hearing. Now that I heard na 2013, 2014, di ba? So, klaro naman na that the intent was really for zero billing. Ang problema na paglipasan din lang tayo ng panahon. Plus, we learn from experience that if you do a national average, babaksak talaga ang presyo sa in some places like urban dahil mas mahal talaga, 'di ba, yung for many reasons, no. So sir, ito naman yung present mo rin sa sa budget, so that I won't let you continue na if that's okay with you to tell it's on the record and most of us viewed it naman, but I'll insert it into the record na yung presentation niya. Unless there's some parts that you still want to highlight, I'll give you a few minutes. Go ahead, sir.
Mr. Chairperson, if I may, there was an issue raised earlier by our resource persons on the Philhealth Plus. May I just be allowed to finish the
Sir,
presentation?
Philhealth Plus at saka yung, ano ba yung konsulta? Is this precisely yung primary care, di ba? So yung check-ups dun papasok. No?
Mr. Chairman, I'm sorry, Attorney Santos, not to interrupt. I came here because I love my brother. He's a brother in Christ, but I'm also a son, and I have to go to Bulacan and come back here again. And I'm sure our chairman would understand the importance of where I'm going right now. But I just want to put on record that I also have some questions, and I share the concern of our chairperson when I actually heard that statement made by our OIC and CEO dun sa House Committee Appropriations that unless a massive infusion of government subsidy is done, a fund life of Philhealth can only last until 2027. And I'm sure mahaba yung sinabi niya pero yun lang yung kinote sa inyo, no? Kaya gusto ko sanang maliwanagan doon, but perhaps if you could just furnish us a copy na kasi kanina yung I catch up with some of your presentation that there's no cost of alarm, and at the same time syempre yung sa updates on the payment of COVID-19 related claims. Alam nyo yung data natin kasi ito yung of the total amount 15.8 billion or 75% accounted for inpatient. Tapos 4.8 billion or 22% for testing. 617.6 million or 3% for isolation. So kung titignan natin, about 95% of the claims count are for testing, and then 4% for inpatient and 1% for isolation. So, yun sana gusto kong malaman, but for lack of time, kung siguro pwedeng bigyan na lang tayong isubmit na lang kung ano yung efforts natin dito because again, may data rin po ako from January 1 to June 30 of 2022. There have been a total of 2,011,664 na COVID-related claims. 2,011,664 na related claims amounting to 21.16 billion. So gusto ko lang maintindihan yan, Mr. Chairman. I'm sorry that I have
On that
given you-
point, Majority Leader, because maganda din yung mga input ng iba't ibang grupo. So the staff will put together yung points ninyo and anyone who wants, will distribute it, and anyone who wants to submit a position paper so that we can see which technical working groups have to get moving and which ones are issues we have to do with the Committee on Health and which ones are issues na amendments sa batas mo that we can do ourselves, no? And maybe we can furnish Senator Joel with the data he wants para before the budget hearing then kung may discussion mapag-usapan na.
Yeah, just
But
to
I'll
put
give you a
that on
copy of
record, Mr. Chairman, because that's the reason why we are here, and there are issues that we need to tackle with the time frame because we're tackling the budget by in the next 2-3 weeks. We'll tackle the budget on the floor. Siyempre, kung may mga kailangan, and then sa legislation, ano man yung kailangan. Gaya ng sinabi ko when I first started talking here, I'm here to support our chair and Philhealth in any way we can because yung success ng Philhealth is success nating lahat. So maraming salamat, Mr. Chairman. Thank you for all our research persons.
Thank you for the physical attendance, brother. Sir, so pwede mong i-wrap up with the ones you want to emphasize, no?
If I may, Mr. Chairperson, the slide, based on the slide, pursuant to Section 11 of RA 11223 of the UHC Act, Philhealth shall fund for optional supplemental benefits that are subject to additional contributions and manage the supplemental benefits fund to the minimum required to ensure that the supplemental benefit payments are secured. Executive Order 150 also mandates that Philhealth shall implement a premium-based insurance, or GOCC. So this will be the Philhealth Plus. Philhealth Plus, next slide please. Philhealth Plus is defined as supplemental health coverage to government employees on top of Philhealth benefits to cover for services and medicines that are not currently covered in standard Philhealth packages. With the key features, group health insurance, additional coverage for inpatient and outpatient services, premium-based with employer counterpart or fully subsidized by employer. Service coverage will include hospitalization for illnesses, cover for fees on top of Philhealth inpatient benefits and outpatient benefits to include specialist consultations, teleconsultations, diagnostics, and outpatient drug coverage for cases not covered by Philhealth Consulta. Implementation will be available for government employees to fill up lost benefits of government employees as per EO 150. The present slide, Mr. Chairperson, shows the proposed bills filed before this honorable Senate, and we will be submitting our position for each bill. Thank you very much, Mr. Chairperson, honorable senators. Good afternoon.
Thank you for that, and I think we had a productive afternoon kahit na we just laying out yung ating pong mga definition at saka yung mga priorities. Can I end the hearing with just clarification? Dito sa Republic Act 1122(3, entitlement of benefits, di ba? Every member shall be granted immediate eligibility for health benefit package, Section 9 to, no, under the program, provided that Philhealth card shall not be required in any availment of any health services. Ito yung binabanggit nyo kanina, no? Provided further that no co-payment shall be charged for services rendered in basic or ward accommodation. What does that mean? What is basic or ward accommodation?
Mr. Chairperson, that means that basic accommodations, meaning no other amenities like we usually find in the private rooms like refrigerator, aircon, TV. It just simply means basic accommodation, Mr. Chairperson. And may I request our SBP Doc Lem Bautista to add to that, Mr. Chairperson, please?
Yeah, Mr. Chair, yun nga po, ang kasama po dun talaga sa basic accommodation is just there's a specific room conditions like walang aircon, we have beds, and health services are being provided, the basic health services are being provided. But
Directive na no payment is directed to Philhealth or directed to the patient? Hospital. The hospital. So meaning, halimbawa nga, no, may emergency, buntis, dumating nga siya doon, nilagay sa ward, sabi nga sa charity. Pero sinabi, kailangan talaga cesarean. Kung hindi, may endanger yung life ng bata at saka nung ina. Pero ang cesarean sa kanila ay 75,000. So will she be asked to pay above 22,000? Or kasama na siya dito?
Actually, sir, that's something that we want to be also clarified as to the intention of the law.
Yeah.
Because for the health finance policy sector in Philhealth, when we speak of no co-payment or co-payment, in particular, this refers to the payment of or what is to be paid for or out of pocket of the member. And the question there is on the no co-payment policy, whether whatever is the excess bill of the patient, should it be shouldered by the hospital or should it be shouldered by the Philhealth? So I think that's the
Yeah, so let's do it together. Let's clarify it because of course may financial implication to. But in the end, ang gusto kasi natin, di ba, pag emergency cases, hindi na talaga nag-iisip kung paano magbayad. Parang saka na natin i-figure out. Kasi gusto natin, they take care of it. But so rin naka-experience na ako. But this was years ago, about maybe 10, 12 years ago, na tinawagan ako ng kaibigan ko. Pwede mo ba akong tulungan? Nasa ospital ako, may nasagasaan ako sa C5. Sabi niya, matanda. Ang sabi pa niya, it turned out that he was so stressed na nakasagasa. Bata yung nasagasaan niya, hindi matanda. But ayaw ipa-X-ray at ipa-MRI nung CT scan nung doktor. Kasi sabi ng doktor, hindi emergency yan. Ano yan? Diagnostic. So nakipag-argue pa ako na paano mo malalaman kung life-threatening unless i-diagnose mo. Di ba? So, but this was years ago. I mean, so many, more than a decade ago, many things have changed. And, you know, Philhealth has improved so much. But these are the things we have to clarify. Kasi precisely, and I want to end on this note, no, na can we all agree na ang vision naman natin as a country, as a people, no, following the biblical phrase nga or whatever we believe in our spiritual belief na malin mo Diyos, malin mo tao, na dapat si Juana de la Cruz, pag nagkasakit, hindi matakot pumunta ng doktor o sa ospital dahil sa gastos. Yeah? Definitely may gastos, may problema dyan. Pero hindi dapat siya mapigilan from going. And really sa grassroots hanggang ngayon, hindi nawawala yung gano'n na, sir, gastos lang yan, sir. Mapapalaki problema pa kami dyan, no? So I want to end at that note, no, and you know, to agree lang at least on the vision so that as we work together, and again nga, I will consult Senator Pia and Senator Bongo because nga, ito talaga ang kanilang, pasok na tayo dun sa laman nung functions nyo more than just the law, no? But if there are any other provisions that you want nga to na magtulungan tayo mag-clarify, no, let's clarify that. But I think it's very important that together with the public and private hospitals, klaro nga sa Pilipino na pag may sakit ka at lalo kung agaw buhay na mag-isip muna kung sino magbabayad, sumugod ka na sa ospital, di ba? So thank you very much, ladies and gentlemen, and it's been a productive afternoon. We hope to, you know, find the time to na isunod-sunod at ayusin lahat ng problema dito. Thank you, and we wish you the best sa bago niyong mahirap na assignment.